You know, trying to navigate a health challenge these days, it can be just so overwhelming. It's really easy to feel lost. So today, we're going to look at two incredible forces that are completely changing the game for patients: brand new medical science and the amazing power of community. Let's get into it.
And really, it all starts right here. I mean, this quote, it just hits home, doesn't it? It gets to a fundamental truth. Long before you even get a diagnosis or a treatment plan, there's this feeling of being totally alone. That silent, personal struggle. That's often the heaviest thing to carry. So, let's talk about that silent journey. Because for so many people, that's exactly what it is. A path that starts quietly with no map to guide you. A lot of times, it just starts as this quiet, private worry. Take, for example, women who are dealing with a persistent drop in sexual desire after menopause. That is a really tough thing to talk about, right? It feels so deeply personal. And a lot of the time, the very first step is just admitting to yourself that, yeah, something's different. And then, that quiet concern gets a name. It becomes a diagnosis. And if it's a chronic condition, well, that journey can feel like a marathon that just never ends. And we're not just talking about a medical thing here. We're talking about a test of your endurance, socially, psychologically, logistically. I mean, it touches every single corner of your life. So, you're running this marathon, but guess what? You don't have a map. Sure, your doctor might give you some clinical data, maybe a handout, but there's this huge gap between that piece of paper and your actual real life. Like, how are you supposed to handle side effects while you're at work? What do you actually eat? Those are the questions that a pamphlet from the doctor's office just isn't going to answer. And it's that feeling of being completely lost, that really pushes us to find better answers. And the good news is, today, those answers are showing up from two different directions. We've got super specific medical innovations on one side and these incredible community platforms on the other. So, let's start with the science. Okay, so let's look at a case study. We're going to dive into a specific medical tool that was created for a need that went unmet for a really, really long time. It's a perfect example of how science is now offering real options for things people used to just suffer through in silence. The condition we're talking about is called Hypoactive Sexual Desire Disorder, or HSD. Now, the key thing to understand here is that it's a specific combination of things. It's not just about having a low desire. It's a low desire that persists, that causes real, significant distress, and that can't be explained by another medical issue or problems in a relationship. This is a recognized medical condition with a real diagnosis. So, not long ago, the FDA expanded the use of a non-hormonal medication called flibanserin, you might know it by the brand name Addy, to include postmenopausal women. But, and this is a big but, it's for a very specific group. It's for women whose HSDD is what they call acquired, meaning it developed after a period of normal desire, and generalized, which means it happens in any situation. So yeah, this is definitely not a one-size-fits-all pill. It's a very targeted tool for a very specific type of patient. Okay. I need you to listen very closely here. This is super important. Anytime we talk about a powerful medical tool like this, we absolutely have to talk about safety. And for this medication, there are some critical warnings you just cannot ignore. This is exactly why talking to your doctor is non-negotiable. So let's just go through these key points. First and most important, you must avoid alcohol completely. The risk of your blood pressure dropping dangerously low and even fainting is very real. Second, you have to tell your doctor about literally everything else you're taking. Other meds, supplements, even things like grapefruit juice can cause interactions. And third, if you have any kind of liver problem, this is not for you. This is a serious medication that demands careful, professional oversight. Okay, so that's one path, a really targeted scientific tool. But what about that daily marathon we talked about? How do you navigate that? Well, that brings us to our second path, the incredible power of shared experience. And this right here really nails the massive shift that's happening. We're moving away from the old model, where information just flows down from the doctor and the patient is kind of passive. Now we're seeing this new model emerge, one built on collective knowledge. It's about no longer just being a patient, but becoming an empowered, active partner in your own health journey. And platforms like HealTalk are building this whole new ecosystem around this idea. So here's how it works. First, you have patients sharing practical, real-world advice, the stuff you'd never find in a textbook. Then, and this is crucial, you have experts who jump into the forums to validate that information and answer questions. The platform also gives you instant access to info on new treatments from all over the world, which means you can have way more informed chats with your doctor. And maybe most importantly, there's the social side.
That simple, powerful feeling of knowing you are not in this alone.
And that's the whole point, right there. The goal is to transform the passive patient into a knowledgeable and powerful one. And look, it's not just about emotional support, though that's huge. It's about becoming better at actually managing your own health. When you share knowledge in a community like this, it literally becomes a source of power. It helps you make smarter decisions, and honestly, helps you stick with treatments that might be really tough to get through on your own.
All right, so we've looked at two really powerful approaches, a very specific medical tool and a broad community platform. The big question now is, how do you put those two things together to build your own empowered future? And this, right here, is the main idea. It's so simple, but so powerful. Science gives you the tools, but community gives you the strength. See, the modern health journey isn't about picking one or the other. The absolute best approach is to combine them. You use the cutting-edge tools from science, and you fuel yourself with the strength and wisdom you get from a community.
So what does this actually look like for you in real life? It's all about building your own personal health toolkit. That means, yeah, seek out those targeted medical innovations that might be right for you, but also tap into that incredible collective wisdom of people who've been where you are. The goal is to become an active, informed partner in your own care, and that means talking to your doctor about all the available tools, both the clinical ones and the community ones.
The bottom line is this: you don't have to walk this journey alone anymore, and you don't have to do it without a map. The tools we have today are more powerful than ever, and the communities are more connected than ever. So really, the only question left to ask is, how are you going to use them to write the next chapter of your health story?